Practical Guide to Breast Cancer Prevention. Breast cancer, a prevalent malignancy affecting millions worldwide, stands as a pivotal health concern. Its early detection is crucial, significantly enhancing survival rates and treatment effectiveness. Despite the alarming statistics indicating a rising incidence, advancements in medical science offer hope through improved awareness, screening techniques, and therapeutic interventions. This article aims to demystify breast cancer, elucidating its types, risk factors, and the latest in management strategies, while underscoring the importance of research and community support in combating this formidable disease. Types of breast cancer. Breast cancer manifests in various forms, ranging from non-invasive, like ductal carcinoma in situ DCIS, where cancer cells are confined to ducts, to invasive types that spread into surrounding breast tissue. Invasive ductal carcinoma, or IDC, is the most common, accounting for about 70 to 80% of cases, while invasive lobular carcinoma, ILC, is another notable type, originating in milk-producing lobules. Less common but aggressive forms include inflammatory breast cancer and Paget's disease of the breast, both presenting distinct symptoms and requiring specialized treatment approaches. Understanding these variations is vital for effective diagnosis and tailored treatment planning. Risk factors. Understanding breast cancer risk factors empowers proactive health management. Genetic mutations, notably in BRCA1 and BRCA2 genes, significantly escalate risk, alongside family history and inherited syndromes. Lifestyle choices such as diet, alcohol consumption, and smoking also play contributory roles. Reproductive history, including age at first menstruation and menopause, can influence risk levels, as can certain hormone therapies and radiation exposure. Despite these factors, many cases develop without clear causes, highlighting the importance of regular screenings for all individuals, particularly those with elevated risk profiles, to facilitate early detection and increase the chances of successful treatment outcomes. Symptoms and detection. Early detection of breast cancer hinges on awareness of symptoms. Lumps, shape changes, skin dimpling, and nipple discharge are red flags. Routine screening, such as mammograms, offers the best chance for early identification. Women are encouraged to perform regular self exams and report anomalies promptly. Diagnostic follow ups may include ultrasounds, MRIs, or biopsies. While not all abnormalities are cancerous, these detection strategies play pivotal roles in catching cancer early, when it is most treatable. Emphasizing symptom recognition and regular screenings can significantly impact survival rates and is a critical component of breast health education. Stages of breast cancer. Breast cancer is categorized into stages 0 through 4, reflecting progression from non invasive to metastatic. Stage 0 signifies non invasive cancer confined within ducts or lobules. Stage 1 to 3 indicate increasing tumor size and involvement of lymph nodes, but confined to the breast and nearby regions. Stage 4 denotes spread beyond the breast to other body parts. This staging system guides treatment decisions and prognostic assessments, with early stage cancers typically having better outcomes. Understanding staging is crucial for patients and healthcare providers to communicate effectively and strategize the most appropriate course of action. Treatment options. Treatment of breast cancer is multifaceted, tailored to the individual's disease stage and biology. Surgery, ranging from lumpectomy to mastectomy, often serves as a first line intervention, aiming to remove cancerous tissue. Radiation therapy may follow to eradicate residual cells. Systemic treatments include chemotherapy, which uses potent drugs to target rapidly dividing cells, and hormone therapy, suppressing cancer growth driven by hormones. Targeted therapy aims at specific genetic features of cancer cells. Additionally, ongoing clinical trials continually refine existing therapies and explore novel treatments, offering hope for more effective and less toxic options in the future. Prevention and risk reduction. Preventing breast cancer involves modifying risk factors where possible and vigilant screening for early detection. Lifestyle adjustments, such as maintaining a healthy weight, regular exercise, and reducing alcohol intake, can lower risk. For those with significant family history or genetic predisposition, preventive medications or even prophylactic surgeries may be options. Regular screenings, including mammography and, if appropriate, genetic testing, are key in detecting cancer early, when it is most treatable. While not all risk factors are controllable, understanding and managing those within one's influence is a vital step toward risk reduction and empowering individuals in their health decisions. Living with breast cancer. Living with breast cancer extends beyond the initial treatment. Survivors often require ongoing care, including regular checkups to monitor for recurrence. The aftermath of treatment can involve dealing with physical changes, emotional recovery, and reintegration into daily life. Access to rehabilitative services, psychological support, and survivorship programs is critical. Support groups play a vital role in providing a community for shared experiences and encouragement. Quality of life considerations, such as managing long term side effects and adjusting to a new normal, are integral to the healing process, emphasizing the importance of comprehensive survivorship care in the journey beyond breast cancer. Current research and future directions. The frontier of breast cancer research is vibrant with exploration into personalized medicine, aiming to tailor treatments to individual genetic profiles. Innovations in genomics are leading to more precise and effective therapies with fewer side effects. Studies are underway to perfect less invasive screening techniques and to understand the mechanisms behind cancer resistance to certain treatments. Furthermore, immunotherapy, which harnesses the body's immune system to fight cancer cells, is showing promise. The continued investment in research is essential for the development of new treatments and for improving the survival rates and quality of life for those affected by breast cancer. Thanks for joining us on this journey through understanding breast cancer. Knowledge is our ally in this battle, and your engagement is crucial. Hit the like button to support awareness, share to spread the word, and subscribe for more empowering content. Together, we're stronger in the face of adversity. Stay informed, stay hopeful, and carry this message forward. Take care, and let's continue making a difference one step at a time. See you in the next video.